but a state could come up with a solution that would work for that state.
Giving the power back to the states, that's Bill Cassidy's solution for America's healthcare system. He says it helps people and states' bottom lines.
Both that family who can't afford their premium, but also the way that Medicaid is eating up both state budgets and the federal budget.
Political experts say that's not necessarily a bad idea. In our Dr. Joshua Stockley.
Give the state an incentive to tailor the program as efficiently as they can, within parameters.
As he sees it, though, this is one part of a solution to a multifaceted problem.
I don't think we can conclusively say the Affordable Care Act is broken for rural America. In fact, the evidence points to the opposite.
And he's right. Rural hospitals have grown under Obamacare, in part thanks to more people getting health coverage. In fact, data from the U.S. Census shows Louisiana's uninsured rate is the lowest it's ever been.
And the Affordable Care Act has done a huge service to a lot of rural Americans.
But what does this new bill mean for you? Well, it would end the mandate that you have to buy insurance, and along with that, the subsidies that helped people buy it.
I regularly get emails from people who say that if they're in the exchanges and they're not getting a subsidy, they cannot afford their premiums. So one guy was telling me...
Sure, right, but doesn't your plan end the subsidies?
So what we do is we take the money that would come from Medicaid expansion, from the tax credits, and from the cost sharing reduction, and that's the whole pool of money that we would then give to the state.
Medicaid expansion would cease to exist, which, by the way, insures more than 400,000 people in Louisiana. Obamacare's taxes would stay in place, though, and all of that money would go directly to the states, and they would have the final say in how it was spent. The problem is states could charge more for people with pre-existing conditions, or for older people if they wanted to. And not only that, but states would only get a fixed amount of cash, so once the money is gone, it's gone. And Cassidy says that spurs innovation.
By giving a capped amount, we're saying, states, if you save money with an innovative program, you can use those dollars you save over here.
Stockley says fundamentally this does not solve the problem, which is encouraging insurance companies to do their part and working together to find a solution.
That's the part that needs to be fixed. I think Republicans and Democrats should be able to easily come together and create a solution for that. It would be a win-win for both parties.
But right now, Republicans are going it alone on health care.
Every solution that we have proposed has been the conservative solution.
The Republicans are doing what Republicans are supposed to do. They are opposing Obamacare. Now they're realizing that campaigning is inherently different from governing.
And Stockley says what we have to do is reach across the aisle. What does a bipartisan health care bill look like that actually works for Americans? Is that even possible?
I don't think it's impossible. And there's a long-standing, proud history of significant policies being made in the United States with the support of both parties.